apa namanya, putusan Mahkamah ada di sana, apa pada mencari solusi, dan kemudian tidak ada yang dilarang, dan acara itu kemudian itu kita atur.
Assalamualaikum warahmatullahi wabarakatuh. Hi everyone, how are you? Welcome to today's paper talk, first episode in this season. Sex and gender differences in the neural working mechanism of addiction. Thank you for joining us for today's webinar. I'm Marije Kaag, researcher from Neuroscience Center Uhamka. I will accompany you for the next 2 hours. Well, I'm so excited, but before we get started, I'd like to go over, a few items so you know the rules in today's event. Okay, please mute the audio during the event. You can ask the question on discussion sessions with format the questions name underscores institutions underscores questions. And at the end of the event, as usual, I will ask you to fill the feedback in real time. Once again, please mute the audio during the event. You can ask the question on discussion session with format of the question name underscores institution underscores questions. At the end of the event, as usual, as I said, I will ask you to fill the feedback in real time. Okay. Still waiting more participants here. Okay. In this episode, we have special guest, Miss Anne Marije Kaag, Ph.D. She is an assistant professor, Universitair Docent from Vrije Universiteit. Hi, hello, how are you, Miss Anne?
Hi, so nice to be here. It's weird to be, well, it's actually quite amazing to give a presentation in Indonesia while being in the Netherlands. So I think it's one of the benefits of this time.
So glad to have you here and sharing valuable knowledge.
Yes, thank you very much. Shall I start sharing my screen or what?
Wait for a moment.
Okay, great.
And guys, as usual, we have Dr. Rizki Edmi Edison, Ph.D. He is the director of Neuroscience Center Uhamka. Hi, Doc. How are you?
Hello, Faye. Assalamualaikum warahmatullahi wabarakatuh. I'm fine. How are you?
I'm pretty good. Okay, dear fellow participants.
Okay.
Addiction is a complex condition, a brain disease that is manifested by compulsive substance use despite harmful consequence. We all know that men and women may use alcohol, drugs, or something else to regulate emotion differently, with corresponding differences in neural responses. Actually, I don't know what to say anymore besides so excited and can't wait to, so Dr. Edmi, the stage is yours.
Okay, thank you very much, Faye. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good evening, Mrs. Anne Marije Kaag. I think I could call you Dr. Anne. Welcome to our one of our webinar called Paper Talks. Rekan-rekan semuanya, saya itu udah diwanti-wanti sama host kita agar berbicara dengan bahasa Inggris. Cuma saya juga langsung dapat WA nih, jangan pakai bahasa Inggris aja dok, coba dengan bahasa Indonesia. Jadi saya akan coba campur-campur bicaranya. Well, Dr. Anne, in this webinar we call as Paper Talk, we always discuss about published research published by the researcher, where whom the speaker is the first author or the correspondence author of the speaker. But for in this episode, this special episode, because I know who you are. I know Dr. Mr. Insan Firdaus, and I also really interested with your research, sex and gender differences in the neural working mechanism of addiction. Nah, rekan-rekan semuanya, pembicara kita kali ini orang yang sangat luar biasa. She is an assistant professor from Vrije Universiteit Amsterdam, and if you really want to know about her career, you also could see her website, annemarije.com, atau juga bisa melihat Google Scholar beliau dengan nama Anne Marije Kaag. Dan kalau kita lihat Google Scholar-nya luar biasa. Edge index-nya pun juga sampai 10. Kita kalau para dosen-dosen, kalau hendak mencapai edge index setinggi itu harus banyak riset yang dilakukan. And if we try to look at her track record of her research, there are so many research that had been done by her. On her website, we also could know that she is a cognitive neuroscientist. Jujur aja rekan-rekan semua, di Indonesia yang namanya neuroscientist itu sangat sedikit. Sekarang masuk ke ranah cognitive neuroscientist, ranah yang lebih sedikit. Dan di antara yang sangat sedikit itu telah hadir di hadapan kita Dr. Anne Marije. Dan di websitenya kita bisa melihat beliau menjadi Ph.D. di tahun 2016. Dan kalau kita melihat bagaimana progres papernya, sejak ia menjadi seorang Ph.D., publikasinya luar biasa banyak. Rekan-rekan bisa melihat Google Scholar. Kalau kita para peneliti melihat orang-orang yang prestasinya seperti ini, rasanya ingin join aja. Bisa berkolaborasi riset dengan beliau. Nah, seperti apa risetnya? Untuk sesi kali ini, kita akan sedikit memberikan sesi agak spesial. Biasanya paper talks itu harus sudah publish terlebih dahulu. Tapi kita mendapatkan kesempatan mengetahui terlebih dahulu seperti apa risetnya sebelum ia telah publikasikan. Tentu menjadi suatu kehormatan bagi kita semua. Judulnya sangat menarik. Sex and Gender Differences in the Neural Networking Mechanism of Addiction. Nah, Dr. Anne Marije Kaag, actually, in our center, in Neuroscience Center Uhamka, we are also doing research about addiction. We are making the brain mapping of porn-addicted adolescents between porn-addicted and non-porn-addicted adolescents. We try to make the brain mapping by using electroencephalography. So, here is a big honor for us to hear your research entitled Sex and Gender Differences in the Neural Working Mechanism of Addiction. You have 20 minutes for presentation, and we have 30 minutes or more for discussions. So, time is yours, Dr. Anna.
Thank you very much. I will try to stick within the 20 minutes. Or I will stop earlier if there are questions in between. I will answer them. I will start sharing my screen now. Oh, the host disabled participant screen sharing.
Okay. Now you're ready to share the screen.
Yes. Yes, thank you. All right. So if everyone can see my screen, I will start my presentations indeed about sex and gender differences in the working mechanisms of addiction. I'm very honored to be here, and I think it's amazing that these times allow us to actually give a presentation in Indonesia while being in Amsterdam. Let me see. So the reason why I started doing research into sex and gender differences is that because I noticed that there was actually very little research on this topic. But before I start going into my own research, I would like to just emphasize the difference between gender and sex, as these terms are often mixed up by other researchers and within scientific publications. So gender actually refers to the socially constructed roles, behaviors, expression and identities of girls, women, boys, men, and gender diverse people, such as non-binary people, while sex actually refers to the biological attributes of humans and animals, including physical features, chromosomes, gene expressions, hormones, and anatomy. And while I really want to specifically study gender differences in the future, in my own research at this moment, I mainly focused on sex differences. So just that is an important note before starting my presentation. And the reason why it is so important to focus on this, I think there are many reasons, but I think this is a really important example that 8 out of the 10 medications that are taken off of the market because they show adverse side effects that are unexpected are taken off of the market because they have adverse side effects or they are not beneficial to women. So in earlier studies in the clinical trials, this didn't show up either because women are not included or because sex differences were not investigated. So I think this is one important example why it is really relevant to focus on sex differences in health research. So if we'll take a look at addiction, there we can also see there's a huge bias in research focusing mainly on men instead of women, while approximately 30% of all patients with an addiction is women or is female. And this differs a little bit depending on the country. So this is mainly based on the countries from Europe. But I think on average, 30% of the people with an addiction is female. Unfortunately, most research actually focuses either only on men or does not investigate differences between men and women. We do know, however, from case reports, from qualitative interviews, that women with an addiction have more severe medical conditions. They have more psychiatric comorbidities such as depression and anxiety, and they also tend to escalate their drugs and alcohol use faster than men do. But really hypothesis-driven and empirical research into sex differences in addiction is currently lacking. So if we take a closer look into the neural mechanisms of addiction, we can differentiate between 3 important neural pathways. The pathway that is involved in positive reinforcement, drinking and taking drugs because of the rewarding effects. Negative reinforcement, which often develops more in later phases of addiction, taking drugs or alcohol because to reduce negative effects, to reduce stress levels. And then there's an important process that relates to cognitive control or actually the lack thereof. So people with an addiction often have a high motivation to use drug and impaired cognitive control over their behavior and impaired cognitive control over their emotions. So a lot of research in addiction actually focused on the neural processes involved in positive reinforcement by studying how the brain responds to stimuli that are related to drinking or drug taking behavior. So this is an example from a study that I published in 2018 in which I investigated sex differences in alcohol cue reactivity. So in this study, we showed pictures to people that were heavy drinkers that were either related to alcohol. So this is a very famous beer brand in the Netherlands. And we compared their brain response to that to how the brain responded to seeing soda pictures, so pictures of Coca-Cola, for instance. And what you normally would see in studies, and these are again studies mainly based on male populations, is that seeing these kinds of stimuli strongly induce activation of the dopaminergic pathways, including the striatum and the prefrontal cortex. So I was interested to see how this may differ between men and women. So I included 28 heavy drinking men and 27 heavy drinking women, and they had an average audit score of 19, which is indicative of severe drinking behavior. And we showed them these pictures while they were lying inside an MRI scanner. And what we saw in men, when we compared their brain response to seeing these alcohol pictures compared to these neutral pictures, we saw the classical pattern that has been reported by other researchers. So activation of the striatum, the prefrontal cortex, and also the amygdala. But when we were looking what happened in women, what you can see here is that actually very few brain regions responded to seeing alcohol pictures. So we zoomed in specifically to the prefrontal cortex and the striatum in the statistical analysis. And what you can see here is that in black is the brain responses to seeing alcohol pictures compared to soda pictures in men, and in gray, the response in women. And a positive value in this graph actually represents the classical pattern that you would see in these kind of paradigms. So stronger activation to alcohol cues versus soda cues. And you see that we see this pattern in men, but that is actually absent in women. So I'm not the only one that studied this. There have been other researchers that also suggest that these processes of positive reinforcement may play a stronger role in the development of addiction in men than it does in women. So this was one of the first indications for me that it would actually be very relevant to look into these sex differences between men and women with an addiction. So in my research I started after this, I focused on people with a cocaine use disorder. This is actually also how I started my scientific career, focusing on people with a cocaine use disorder. And I wanted to see whether we could also find sex differences related to negative reinforcement and related to impaired cognitive control. So the study or the publication I'm currently working on, I'm going to present now, and it has, I just received that it is accepted pending some minor revisions. So I think it will be published within 2 months in Addiction Biology. So in this study, we included cocaine users, men and women, as well as non-drug using control. So people that didn't use any drugs at all. Approximately, 27 to 28 people in each group. And of these people with a cocaine use disorder, almost 90% actually met the criteria for a cocaine use disorder according to the DSM-5. And they had an average DUDET score, so that's a drug use disorder identification test score of 17, which is also highly indicative of a cocaine use disorder. It is important to note that I focused on people that were not in treatment. So these were not treatment-seeking people. I recruited them through social media mainly, and advertisement in restaurants and clubs and on the streets. But these were all people that were not actively seeking treatment. And to investigate the neural mechanisms involved in impaired cognitive control, we let them do an MBAC task, a working memory task, while lying in the MRI scanner. I won't go into details into this task, but it is a very often used working memory task, which allow you to investigate the neural processes that are involved in working memory, which is an important aspect or index of cognitive control. So when we did this, we saw both in cocaine users and controls a very classical pattern of activation of the, in red, the dorsal lateral prefrontal cortex. This is the brain region heavily involved in working mechanism, working memory, and we saw deactivation of the default mode network. And this is what you would classically see when you do these kinds of tasks. But there was one specific brain region that showed a differential response in cocaine using men and cocaine using women compared to controls. And that was this region here in green, the middle frontal gyrus. So it's part of the dorsal, or it's part of the middle frontal cortex. So what we saw when we compared cocaine using men compared to control men, that in cocaine using men, there was a deactivation in this brain region while doing a working memory task. And this, by some, this is, they make an interpretation of this data as that it is suggestive of impaired prefrontal functioning. But there was, we didn't see any behavioral differences. So that's quite important to note that we actually didn't see any differences on a behavioral level, but we did see differences in the brain reactivity. But when we looked at women, the pattern was completely different. We actually saw enhanced activation or stronger activation in the female cocaine users compared to the female non-drug users. And enhanced, stronger activation in this region is something seen quite a lot in people with an addiction. And it actually suggests that the prefrontal cortex needs to work harder in order to perform similarly or to perform equally as we see, because there were no any behavioral differences. So while we are still struggling a little bit with what to make of this data, I think one important thing that it shows is that there are quite strong differences between men and women. And if we had not taken into account sex in these analyses, we would actually conclude that there were no differences between cocaine users and controls, while these differences are actually quite strong. So in addition to this analysis, we also looked at how brain activation during a working memory task related to drug use severity. And this is what we saw. So we saw a significant interaction within the inferior frontal cortex as well as part of the insula, which are regions important, mainly implicated in craving. And what we saw is that activation in this region during the performance of a working memory task was strongly related to drug use severity in women, but not in men. So what we can carefully conclude from this study is that there are indications that certain areas in the prefrontal cortex may be more heavily implicated in the development and continuation of cocaine use disorder and probably general addiction in women than it is in men. So this study suggests that the prefrontal cortex may play a bigger role in addiction in women than in men. And this is something, again, that has been suggested by other researchers as well. But the evidence until now has been rather limited. So one part of this study, which is not published yet, is the part in which I focused on the neural mechanisms involved in negative reinforcement. So in the same population, I also wanted to know whether there were differences in how the brain would respond to seeing a negative affective pictures. So I'd like to warn you, I'm going to show an example of the pictures, and it are not pretty pictures to see. They are highly aversive, and we did that because we wanted to elicit activation in the amygdala. So, so the reason for this is that there are overall quite a lot of indications that women generally are more likely to drink to regulate negative effects than men. But current research is currently limited in that respect. So this is one of the first studies that actually try to provide evidence for these differences. So we showed them pictures, very aversive ones and neutral ones. And we wanted to see how the brain reactivity in response to these pictures differed between men and women. So what you can see here, and unfortunately I just saw that the title on the y-axis is incorrect. This is on the left you see brain activation in the anterior cingulate cortex, and on the right you see activation of the amygdala. But most importantly, what we see is that especially in women with a cocaine use disorder, there was very strong activation in response to these negative aversive cues, which we didn't see in all other groups. And the same was true for the anterior cingulate cortex, so the prefrontal cortex. So this suggests or this actually supports our hypothesis that in women, these processes of negative reinforcement may be more heavily implicated in the development of addiction than in men. So this actually brings me to the research I'm planning to do the next year, and that is that we actually want to try to develop more specific, sex-specific treatment targets. And one way to do this is by specifically targeting these processes of impaired cognitive control and heightened stress responsivity in women. And one way to do this is by using guanfacine. So guanfacine is an selective. Yes. Was there a question?
Oh.
No. Okay. So one way to do this is by using guanfacine, which is selective alpha-2 adrenergic receptor agonist. And it has been shown, so it's used in the treatment of ADHD. And it actually has been shown to enhance top-down control of the prefrontal cortex over the amygdala. And also in cocaine users, it has been shown that guanfacine lowers stress-induced arousal and craving in cocaine-using women, but not in men. But we're actually not entirely sure how this is explained in a neural level. So the study that I'm going to do in the next year is a pharmacological MRI study in alcohol-dependent patients, in which we're actually gonna administer 1 dose of guanfacine and 1 dose of a placebo shortly before people are doing an emotional task while lying in the MRI scanner. And we're gonna see whether there are indeed sex-dependent effects of this medicine on activation of the brain stress system. And we actually expect that guanfacine lowers stress-induced activation of the amygdala much more in women than it will in men. And if this is true, this will actually provide us with a probably likely very successful sex-specific treatment for addiction. So again, this is a study that I'm planning to do. I got funding by it from an American funding association, but unfortunately, I do not have any results of this study yet to show. So this was, in a nutshell, what I wanted to tell you about my work on sex and gender differences in the working mechanisms of addiction. And I'm happy to answer questions if there are any.
Okay, thank you very much, Dr. Anne, for your very wonderful presentation. Before we move to our next session, discussion session, now we try to back a little moment to our host. Vrije, silakan Vrije, ada tambahan dari Vrije?
Okay.
Yep.
Thank you very much, Doc. And Miss Anne, thank you very much for the explanation. This is so blowing my mind. So now, guys, this time to Q&A discussions. Dr. Edmi, you will choose 3 contextual questions. To format the question, please just type on chat room, name, _institutions, questions. Okay, once again, Dr. Edmi will choose 3 contextual questions. The format of the question, please just, you guys, you just have to type on chat rooms, name, _institutions, question. Thank you, Doctor. The stage is yours.
Oke, thank you very much, Vrije. Nah, rekan-rekan semua, sebagaimana tadi host kita juga telah sampaikan, jika ada yang ingin bertanya, silakan tuliskan di kolom chat, bisa dengan bahasa Indonesia, bisa pula dengan bahasa Inggris. Silakan bertanya apapun terkait dengan riset yang telah dilakukan oleh Dr. Anne. Tentu Dr. Anne akan dengan senang hati menjawabnya. Nah, Dr. Anne, before we get the questions from the audience, I would like to tell you that one of our main purpose of doing this seminar is to let the audience know how to do the research. What is the limitation that you are facing while doing the research, and what is the solutions? So we, as the audience, could do the same research like you do there. And before we choose the question from the audience, I would like to ask you one question first. In doing this kind of research, what is the main limitation that you are facing on doing the research? Please, Dr. Anne.
So thank you for your question. I think there are many difficulties when you want to investigate sex or gender differences in addiction, or sex and gender differences in health research in general. And I think one important challenge, I wouldn't necessarily consider it a limitation, but a challenge is that women have menstrual cycles and fluctuating hormones that all have an influence on processes of negative effect and craving and cognitive control. So when doing these studies, you actually want to control for variations in menstrual cycle or variations in sex hormones. But that's always that's challenging and not always feasible. So you do ask. So in my research, I did ask about menstrual cycle, but ideally you want to measure the concentration of sex hormones, but that's quite expensive. So yeah, that would be something to be preferred. But if that's not possible, I think it's good to ask about hormonal status as detailed as possible. I think that's important.
Yes, yes. We also have a similar problem in Indonesia. We also have the problem on the budget itself. So we cannot do any research by using the functional MRI because the tool itself only there in the hospital. In our center itself, if we would like to do the research on the human brain mapping, we only have the electroencephalography. I hope in the future we also could have functional MRI. Maybe for the next step, we will have the functional NIRS. I'm really happy to hear your presentation by using the functional MRI. Now, Dr. Anne, we have some questions. The first is from Ku Yusuf Engku Ismail. You also could see on the chat screen.
Yes.
Here is the question. Guaifenesin, is it the same as guaifenesin used in cold mixture? Please, Dr. Anne.
I don't think so. So guaifenesin is used as a blood pressure medication. So I don't think it's used in cough mixtures. But I'm not aware of that. It could be obviously that in Indonesia maybe other names are used than in Europe, but I don't know.
Okay. Oke, mudah-mudahan Pak Ku Yusuf Engku Ismail, jika ada pertanyaan lebih lanjut silakan ditanyakan ke kolom chat. Now, before we move to next question, Dr. Anne, there is a big problem that we are also facing right now. It is a little difficult for us between sex and gender. When we talk about the man and woman, most of the research is talked about the sex, not about the gender. So, what is the main important thing when we would like to differentiate between sex and gender on research, Dr. Anne?
Yeah, so I think that the easiest way so there are many ways to operationalize gender in research, but I think the easiest way to do so is by asking your participants whether they are born as a boy or as a girl. So to operationalize sex, and to operationalize gender, you could ask how they identify. Do they identify as a woman? Do they identify as a man, or do they identify as non-binary? So I think that would be one of the most easiest way to differentiate between the two.
Okay. Thank you very much, Dr. Anne. Dr. Anne, we have a very interesting data from our committee. Almost 40% of our participants is also PhD and doctor, and about 20% of our participants is psychologists. So we really hope that we could get so many insights from your research. And the next question from Ismi Afrianti. Here is the question. What about the concentration of fat content in a woman's body, which is more than water, and certain enzymes that cannot break down addictive substance? Does that have an effect? Please, Dr. Anne.
Yeah, that's a very good question. So there are indeed differences in the effects, for instance, of alcohol on the body of men and women. But that doesn't necessarily translate to differences in how quickly people get addicted. So when we are, what you may probably also know is that addiction is not necessarily diagnosed based on how much people drink, but the problems people experience from the drinking. But it does, I think, has an effect on the acute effects of alcohol on the body. And also, I think it's most important for alcohol, less so for, I think, substances that are, for instance, injected, which are injected directly into the bloodstream. So then the different percentages do not matter that much. But it is an important aspect of understanding sex differences, yes.
Okay, very interesting. Dr. Anne, we also have some issue here. Actually, it is very difficult for us to get, for our paper to get accepted by journal. We have so many revisions from the reviewer, and sometimes it took about 3 until 6 months to finally get accepted for publication. What about your experience, Dr. Anne? Would you please to tell me about your experience for publishing your paper?
So, well, it has been a while since I actually published because of the Corona crisis as well. But the paper which just got accepted, pending revisions, also took like 6 months because they did not find any reviewers. So I got it back 3 times to ask whether I could provide another reviewer and another reviewer. So I think it is, especially in these times, very, very hard to get something published because a lot of people are, I think, busy with other things and have less priority for reviewing papers. So my experience is not much more positive than yours.
Okay. Thank you very much, Dr. Anne. Jadi begini rekan-rekan semua, bahkan untuk level kaliber Dr. Anne sendiri pun juga yang namanya sampai kepada level accepted itu pun juga ternyata tidak mudah. Jadi kalau ada di antara kita semua melakukan penelitian, lalu hendak mencoba melakukan publikasi, kok rasanya lama sekali untuk di-accept, itu adalah ya hal yang wajar lah. Rekan kita yang sebagai host juga sekarang melakukan penelitian, insya Allah akan ada papernya, mungkin nggak tahu lah berapa kali akan ada revisi apa ya. Tapi kalau mendengar dari ucapan Dr. Anne, seperti kita sudah harus siap mental gini. Iya. Nah, the next questions, Dr. Anne, we have question from Miss Rola Apnoza. She has a very simple question, but very interesting. What kind of addiction have you done the research?
So in my previous work, I focused mainly on cocaine use disorder and alcohol use disorder. But in the Netherlands, people with a cocaine use disorder are often polysubstance users. So they also have a diagnosis for an alcohol use disorder, as well as a diagnosis for a cannabis use disorder. That's very mixed. I'm currently working on a study on nicotine dependence, so cigarette addiction. And I actually think that many of the findings that I just presented are not specific to a certain type of addiction, but actually can be generalized to all forms of addiction.
Oh, so you've done very much research, Dr. Anne. Rekan-rekan semua, pada sesi kali ini, jika ada pertanyaan apapun terkait dengan riset, terkait dengan publikasi, ataupun terkait dengan adiksi, dan jika ada di antara rekan-rekan yang ingin langsung bertanya kepada Dr. Anne, jika sepertinya kesulitan menuliskannya di kolom chat, rekan-rekan juga bisa langsung bertanya via langsung berbicara langsung kepada Dr. Anne. Kepada rekan-rekan semua yang ingin bertanya, kami berikan kesempatan untuk bertanya apapun kepada rekan-rekan semuanya. Dr. Anne, I also have a question for you. Sometimes it is very difficult for us to find the participant for doing the research. For our research, for example, we are doing the research to make the brain mapping on the porn-addicted adolescent. It's so difficult to find the person which has a tendency, have addiction on the pornography, and we try to differentiate between porn addiction and non-addiction. If we would like to differentiate between them, we also must have participants that have no addiction at all. So the question for you is, how about your research? Is it also difficult for you to find the participant that has no addiction at all? What is your experience, Dr. Anne?
Yeah, so it's always a very, very difficult thing. I think a lot of, you can either decide to have a control group of people that have no addiction at all, or a control group of people that do have other addictions, but not, for instance, cocaine addiction. I always like to include a group with no addiction at all. And that's hard, especially, well, there are a lot of in the Netherlands, there are a lot of people that use cannabis. There's a reduction in the people that actually smoke nicotine, but it is difficult to find them. So I do try to be a bit lenient. So people in the control group are allowed to have used a certain substance like 5 times in their life, because in the Netherlands, most people actually have used illicit drugs sometimes. But I exclude them from participating when they actually have used more than 5 times in their life, and when there are indications of severe drug use. But it is difficult to find people that are not do not do drugs at all.
Okay, Dr. Anne, I also look at your Google Scholar. There are so many research that published by you and your team. Well, one of the problems that we are also facing in Indonesia, if I look at your presentation, I know that the cost for this research is not cheap, very expensive. What I would like to ask to know to you is, what is your tips to get the funding from the foreign? So we as the audience could also get the funding and also do the research like you.
Yeah, so MRI research is incredibly expensive, and I think the best advice I can give is just to not include MRI in your research. I think I'm also tending nowadays to come up with research designs that do not necessarily need to have an MRI scan, because I think many questions can be answered quite easily without an MRI scan. So I had, I had luck that to work on projects that had funding, but also in the Netherlands, it's so difficult to obtain money. So I wish I could have very good tips on that, but unfortunately, the funding situation in the Netherlands is also not really ideal. So I'm also struggling with finding money for my research.
Oke, baik. Thank you very much. Ternyata dengan walaupun kesulitan dapat the interesting point is also you are facing some struggle to find the funding. But you always could do very wonderful research and publication. We really hope that we could do like you in Netherlands, Dr. Anne. And we also have questions from Ayuhiza, from our host. She asked about this, knowledge about gender differences in pathways into addiction and crime have established that these differences are critical in delivering effect to both women and men. Did you find any gaps in this research? I think it's very interesting questions, Dr. Anne. Please, Dr. Anne, your answer.
So you just fall away a little bit. I will read the question again.
From PN Uhamka.
Yes, I see. Yeah.
Actually, this is question from our host.
Yeah. So there is, if I understand your question correctly, it's about the gender difference in the pathway into addiction as well as crime. And whether these are critical in delivering effective treatments. So I think at this moment there is a huge there is a huge gap. We actually do not know which treatments are effective in men and women, because this research has simply not been done a lot. Yeah, if I understand your question correctly, yes, there is a gap, and we just don't know whether these differences that are shown in the neural mechanisms actually translate to differences in which treatments are effective. Does that answer your question?
Yeah, thank you.
Okay.
Dr. Anne, from your website, we could see that your dissertation for your PhD research, you have research on emotional process in cocaine addiction. Now, dissertation title, are cocaine users too sensitive?
Yeah.
So I think based on...
Oh, you're muted.
We also have a question from Ismi Afrianti. Here is the question. In Indonesia, methamphetamine is currently widely circulating. As an addiction counselor, 80% of our clients are meth users. As an expert, do you have any input for effective therapy, especially for female users? It's a very interesting question because she is asking about the therapy for female, and you presented the differences between men and women. Please, Dr. Anne.
Yeah, it's a very interesting question and a very important one. But I think I also said it in my previous answer. At this moment, there's so little research into which treatments are effective in men and which treatments are effective in women, that I think there's currently no evidence-based answer possible. We just simply don't know which treatments are especially effective for female users. I think the only thing that seems to be potentially effective is the treatment with guanfacine that showed to have sex-dependent effects in cocaine users. But I think the actual clinical trials into sex differences in the effectiveness of this medication are currently still ongoing. So we still need to wait for that research to be done to see whether we can actually have an evidence-based answer on this question.
Oh, very interesting. Thank you very much, Dr. Anne. Dr. Anne, there are so many people that ask me whether addiction could be cured or not. And I said, almost all the disease could be cured, but for addiction, it is not easy. And we really would like to know your experiences based on your research. The questions from Temi Habibi. Here is the question. I have a simple question. Do you find on your research or other research that how can we know that someone has recovered from addiction, especially in brain-based approach? Very interesting. Is there any differences from the addiction and people that recover from addiction? Is there any brain mapping differences between two of them? Please, Dr. Anne.
Yeah, so I think it's not a field that I have done research in myself, the brain mechanisms involved in recovery. But I do know that there are quite a lot of brain processes that do normalize after abstinence. For instance, I think prefrontal cortex functioning does normalize, maladaptive stress responsivity does normalize, but there are still impairments even after long periods of abstinence. So I know that the stress system is still dysregulated after long periods of abstinence. So that actually implies that there is no, on a neural basis, there is probably no full recovery. And also when you talk to patients, I think they always tell me that they will always be addicted. They will not be drinking or not will be taking drugs, but they will always stay addicted. So they themselves do not feel they are cured in a sense that they don't show the addictive behavior anymore, but they will always have the risk of relapsing when they don't watch out. So I definitely think that addiction on itself, it can be helped, but it cannot be cured, I think.
Dr. Anne, thank you very much for your answer. I have a very basic question for you. Up to now, there are so many debates about the differences of brain between men and women. Some people thought that it's only about the pseudoscience or just hoax. But on your research, we also could see the differences between two groups. And based on my research on the last 5 years, well, myself actually do not have any experience to differentiate between men and women. But based on the theory of the neuroplasticity, there is differences between sex and gender. When we try to differentiate between men and women, it's actually, we are trying to differentiate between the gender itself, about the neuroplasticity, about men, between men and women, about the gender. What about your opinion? is the differences of the brain between men or women is just a hoax, like told in some article, or is it true? What about you, Dr. Anne?
I definitely think that it is true that there are differences, that there are differences between men and women in all parts of biology. I think it would be weird that wouldn't translate into the brain. As I also see it in my own research that there are differences. I think the main question is how that translates to behavior, or how that translates to the risk for developing psychopathologies, and that's something we don't know. Yeah, men are generally bigger than women, but that doesn't mean they are more prone to addiction because of that, you know? So I think simple comparisons between the brains of men and women is not on itself very informative. But in the study that I did, in which I compare men with an addiction with men without an addiction, and same with women, I think that will actually lead to some more insight in how what the interaction is between sex and a certain neuropathology or psychopathology.
Okay, thank you very much, Dr. Anne. Dr. Anne, I'm really sure that there are so many questions for you, but maybe they have some problem in internet connection. So if they would like to ask you some question, maybe about how to do the research, how to do some collaboration, can we send you an email to ask you some question about this research?
Yes, of course you can.
Okay,
do you already have my email address?
I think they already have your email address.
Yeah, I already have your email address.
Yes.
So I will email you so soon. After this event, maybe I will collect the question from participant and I will send you my email. Dr.
Anne, we really hope that we could do research collaboration between Neuroscience Center, Uhamka, and VUA.
That would be interesting, yes.
Dr. Anne, before we close our webinar, we should go back to our host because she would like to give some information to all of us. Faye, silakan Faye.
Wow, thank you very much, Miss Anne, Dr. Edmi. Wow, you know, guys, the challenge is not to deny that there are brain differences between the sexes, but to find out their origin to assess their significance in real life situations. So, dear beloved participants, it's time to give us feedback. Yeah, come on. Stand by with your phone. Now, just stand by with your phone, please. Okay, I will share screen. Okay, guys, just stand by with your phone. Okay, please open the browser. Type right now. https://bit.ly feedback PTS2E1 on your searching bar and use code 457974 and 9. Okay, stand by dengan telepon teman-teman semua. Open browser, kemudian di type saja untuk di https://bit.ly/feedback PTS2E1 di searching bar, kemudian masukkan kodenya 457974 dan 9. Okay guys, I will give you a minute to open the Menti. Please input the code, okay, and click submit, okay? Okay. Please type on your browser. On your searching bar, exactly, feedback PTS2E1. Please input the code. Okay, I will share it. Okay.
Dr. Anne, one of the most interesting part of our webinar is we could see the feedback from audience directly in real time.
So, interesting.
Many of us told this moment as Judgment Day. So you can see the feedback from audience about your presentation, about this webinar, and etc.
Yeah, Miss Anne, this is like, you know, a tradition and aside this in our event actually, the audience giving their opinion for our quality so that we can perform better, and then we will turn the result into an infographic. Okay. Just don't worry guys, we will keep rolling until the end of the event. Okay, keep rolling until Okay. How important is the material presented to you? Okay. Nah, this is quite interesting. Okay, guys, stand by with your phone. Okay, thank you. I really appreciate it. Wow, interesting. Great insight, insightful. Very interesting. Oh, I can feel the positive vibes right now. Menarik. Okay, next. What do you think about quality of the speaker? Oh, very good. I really appreciate it, guys.
Dr. Anna, would you please to give a very simple answer to me, to us, why do you want to be a cognitive neuroscientist?
The brain is fascinating.
I agree with you. The brain is fascinating. And also it seems like a lot of mystery.
Yes, yes, yes. Well, actually, I also have PhD on neurosurgery, and the reason I would like to be a neuroscientist because I really love human brain, about the human behavior. So the best way to understand the phenomena is to be the neuroscientist, the researcher on the neuroscience field.
Oh my God.
There's so much still to learn.
Yes,
So
yes,
that's
yes.
amazing.
Yes.
Thank you, guys. I really appreciate it. Dear participant, please mute the audio during the event. I'm sorry, would you please to mute your audio? What do you think a faculty of neuroscience established at Uhamka? Oh my God. Oh, my person. What do you think, Dr. Edmi?
It's very good. It's very good. I think tolong doakan mudah-mudahan bisa ada prodi neuroscience di Uhamka ini. Okay.
Miss Anna, we have planned to build, faculty of neuroscience here. What do you think? It will be the first in Indonesia, I guess.
Sorry, can you repeat your question?
Yeah? Oh yeah. What do you think if we build the faculty of neuroscience at Uhamka? Because I guess it will be the first in Indonesia, maybe.
Yeah, that would be amazing, right? To have the opportunity to do that, to teach about neuroscience too.
Of course.
Yeah.
I'm so excited about neuroscience things or brain things. Okay. Okay, while waiting, okay, I will keep rolling the feedback. And then, okay, there's participant, if you want to get the certificate, please fill the form. And I will once again share screen. Okay. Nah, okay. Dear participant, if you want to get the certificate, please fill the form or you just scan the barcode. Okay, the certificate will automatically on your email. Okay, once again, if you want to get your certificate, just please fill the form or just scan barcode. The certificate will automatically on your email. Okay, and we will share on our group too. Okay, too bad I have to say bye to you guys, but don't worry, we will be right back next week with a great speaker. So, Miss Anna, is there anything would you like to say about the impression or maybe message of this session?
Well, I was very happy to be able to speak to you all and have such a lot of interesting questions. It's always nice to give an online presentation and that people are actually interested. So thank you for listening and asking so many interesting questions.
Okay, thank you. I hope we could, do a lot of collaboration in research fields. I hope so. And Dr. Edmi, do you have something to say impression or maybe message in the session?
Oke, terima kasih banyak Faye dan juga Dr. Anne. Rekan-rekan semuanya, mudah-mudahan apa yang telah dipaparkan oleh Dr. Anne bisa menambah wawasan kita dalam melakukan penelitian. Memang tujuan utama kita Paper Talks ini sedikit berbeda dengan Neuro-Insight. Kita betul-betul ingin menggali seperti apa riset itu dilakukan. Apa kira-kira tantangan-tantangan yang dihadapi dalam melakukan sebuah riset, mulai dari penelitian sampai tahap publikasi. Tentunya kita berharap dari apa yang telah dipaparkan Dr. Anne ini menambah insight bagi kita semua. Jangan bosan untuk mengikuti acara yang diselenggarakan oleh Pusat Neurosains Uhamka ini. Gitu ya dari saya, Faye.
Okay, thank you, Miss Anne and Dr. Edmi. Well, guys, I'm Marije. I'm so glad to have you guys here, Miss Anne Marije. Maria, I'm so glad to have you sharing a lot of valuable knowledge and also great moderator for today's session. Dr. Edmi, thank you very much. Hope you guys learned something today. See you next week, everyone. Bye-bye.
Thank you very much, Anna. Thank you very much.
Bye-bye. Thank you.
We have photo session, okay? Okay. Please open, okay. Please turn on your video. Okay. Okay. One, I will count on 1, 2, 3, okay? And then, okay, still waiting, okay. Okay, are you ready, guys? We have 3 pages. Okay, 1, 2, 3.
Well, for our documentation, Dr. Anna, we must take some pictures.
Okay, again.
Okay.
1, 2, 3.
Ya, ayo nampakin giginya.
Okay, last pages. Okay, 1, 2, 3. Okay, great. Thank you guys. See you next week. Thank you, Miss Anne Marije Kaag, for your time. And Dr. Edmi, thank you for your time. Bye-bye. See you next week.
See you, Dr. Anna. Assalamualaikum semuanya.
Assalamualaikum, saya Yuhiza, saya adalah seorang data analis di Pusat Neurosains Uhamka. Nah, teman-teman semua, mau tahu kegiatan kita sehari-hari di sini? Ikutin yuk! Nah, teman-teman semua, ini adalah kerjaan saya mau ngolah big data atau berbasis data dengan our program. Nah, saya di sini sedang menganalisa tentang George Floyd di media sosial. Dan ternyata, tada, inilah hasilnya. Nah, rekan-rekan semua, tahu apa aja kegiatan yang lainnya, yuk simak.
Hai, saya adalah staf administrasi dan keuangan di Pusat Neurosains Uhamka. Yang saya lakukan adalah melakukan manajemen keuangan seperti controlling, budgeting, dan pelaporan, baik itu pajak maupun RAT. Kemudian saya juga melakukan pengurusan administrasi seperti surat menyurat dan laporan kegiatan. Saya lanjut dulu ya.
Oh, udah boleh. Halo, nama saya Rani. Saya salah satu researcher di Pusat Neurosains Uhamka. Keseharian saya di sini sebagai operator EEG dan juga mengolah data hasil rekamannya. Kalau untuk di sini saya menggunakan EEG 32 channel, tapi ya masing-masing penelitian menggunakan jumlah elektroda yang berbeda-beda sih, jadi ya sesuai kebutuhan aja. Lalu untuk pengolahannya sendiri, kebetulan saya lagi mengolah data. Ini contohnya kalau yang untuk kondisi adiksi dan non-adiksi, ini saya lagi ngebersihin datanya dari artefak-artefak. Nah, kita di sini menggunakannya Neuro-Insight dan Neuro-Insight. Paling ya gitu ya keseharian saya. Oke, makasih.
Halo, saya Ahmad Syahabudin. Saya sebagai Public Relation di Pusat Neurosains Uhamka. Biasanya saya mengedit foto dan video untuk keperluan PR Pusat Neurosains Uhamka. Tapi ada yang menarik. Saya selalu menganalisa terlebih dahulu foto dan video yang saya telah edit menggunakan alat eye tracker. Nah, sebagai berikut.
Well guys, itu semua adalah kegiatan kita di Pusat Neurosains Uhamka. Untuk kamu yang mau tahu kegiatan kita semua di Pusat Neurosains Uhamka, jangan lupa di follow Instagram @PN Hamka dan juga YouTube channel kita. Ikutin vlog kita terus ya. See you!